UNAIDS and the South African National AIDS Council today launching the Global AIDS Update Report in Germiston. This report, which is dubbed AIDS Crisis and the Power to Transform, is expected to reflect on the global impact of the donor funding cuts. The report provides a comprehensive overview of the epidemic. It also includes data on the number of people living with HIV, any new infections, as well as AIDS-related deaths, as well as access to treatment, amongst other key indicators. The last report last year showed close to 40 million people are still living with HIV across the world. Watching developments is our senior reporter, Griselda Lewis, who joins us now live from Germiston. And Griselda, hopefully what will unfold from this is insight for those who are entrusted with coming up with policies around how to in fact deal with the epidemic, not only in this country, but certainly around the world.
Well, certainly, Ayanda, as the UNAIDS Global AIDS Update 2025 report will be released this morning, I mean, many of the barriers and inequalities, holding back sustainable progress against HIV have not been dislodged as yet. I mean, there's still stigma, discrimination, punitive laws, gender inequalities, and violence that continue to sabotage people's attempts to stay HIV-free or to live safe, healthy lives, if they acquire HIV. I mean, far too many governments, we understand, still lack the political will to provide HIV-related services and protection for people from key vulnerable populations. And this, of course, would include your adolescent girls, young women who are most at risk of acquiring HIV and, experiencing HIV-related stigma, discrimination and violence as well. I want to talk about the South African context and where we are exactly now. The South African National AIDS Council CEO, Dr. Thembisile Xulu, joins me now. Doctor, thank you very much indeed for your time this morning. First of all, let's start there. I mean, where are we as South Africa at this particular point? I know, and I'll speak about it a little bit later on, one of the issues of getting people to stay on treatment is still a problem, but where are we now?
So thanks a lot. When you look at how the United Nations wants us to position our progress in terms of the HIV response, you look at what are called the 95-95-95 targets. South Africa is doing relatively well in terms of the first 95, the number of people tested, but we are only at 79% for the second 95 because we expect 95% of people who know their HIV status to be on treatment. So we have a high number of people that fell off during COVID and a number of people that are out there that know their HIV status, are living with HIV but are not on treatment. We are fortunate in the sense that from a funding perspective, the government actually funds the HIV treatment response to the tune of 77%. So even with the funding crisis that we have seen, South Africa is lauded for actually bearing from a national fiscus perspective, the bulk of the HIV treatment component. On the viral suppression side, we are also doing relatively well because we want people who are on treatment to actually be virally suppressed so they don't pass on new infections, but that only relates to the 79% that are on treatment, which is why the minister then launched the 1.1 million Close the Gap campaign for the country to try to find this 1.1 million that are missing from the middle 95 so that we can meet the UNAIDS 2025 targets.
And what would be the contributing factors to, for example, people not remaining on treatment? There could be an array of issues that may contribute towards that.
Right. So when we look at the data, because the data is what really informs us, we are aware that the populations that we need to be chasing particularly are young people. We are looking for children. We are looking for men. And we are looking for key populations. Men, by virtue of their nature, health-seeking behavior is not their best thing. So it's about looking at male-friendly services and trying to get to men in a way that makes sense to them. So we are involving them through traditional leaders, traditional health practitioners, through conversations namadoda, so that they say, this is where you'll find us. This is what a service must be like so that it makes sense to us. For children, children are dependent on adults to bring them to health facilities. When you look at the fact that only 66% of children are on treatment in South Africa, you wonder whose children are these, because the adult males and adult females are doing well. So getting to children is an issue that requires us to be able to reach their caregivers, but also to make sure that the formulations that we have for treatment are palatable and can be taken by children because it's only recently that we've started. We are also looking for key populations, as I've mentioned, female sex workers, men who have sex with men, and the issues of stigma and discrimination are still quite real. South Africa, though, does stand, I think, on top when it comes to the African agenda. In terms of how liberal we are, we have a sex worker plan. We have services that are geared for key populations that are funded by government. So I think there is a lot that's being done in that sense, but we know where we are searching. That data has been cascaded down to facility level. So even here at Pekowa today, they presented to the minister to say, Minister, when you launched in February, these were our targets, and now we are at this point in terms of our achievement towards the 1.1 million.
Doctor, thank you very much for your time. Do appreciate it. Thank you very much indeed, the CEO of the South African National AIDS Council. Of course, Dr. Thembisile Xulu, speaking to us on quite a number of issues. We're expecting the program to get started any time now. It'll give us a sense of what this global report will say now about what South Africa's standing is globally as well, in particular relating to the funding cuts that we saw.
Right, Criselda Lewis, we look forward to that official launch. For now, thanks very much indeed. Criselda reporting live from Germiston.